Hi, I'm Dr. Jamie Skipper from Elevation Health Consulting. We're here at Digital Health Summit at CES 2020, and I'm here with Dr. Daniel Kraft, founder and chair of Exponential Medicine and faculty chair at Singular University. Welcome.
Great to be back.
So we were talking off camera, and you have just so many things going on in your back pocket that we can share today. But let's start with what you're doing at Exponential Medicine.
So I've been lucky since the beginning to chair medicine for something called Singularity University, and I've spun out a program called Exponential Medicine, which is the idea that many of the technologies, as exemplified by what's happening here at CES, are moving at an exponential rate. What used to fit in a supercomputer in a room now fits in our Apple Watch or embedded in our clothes. And the potential is to expose clinicians, patients, healthcare systems, what's happening in wearables, under wearables, big data, AI, robotics, 3D printing, nanotech, drones. All these things are moving and accelerating. How do we put them together to reimagine how we do prevention, diagnostics, and therapy? So that's a bit of the theme of Exponential Medicine. We have a big conference every year. Exponentialmedicine.com has tons of great videos and content from that. But the main part is also to change people's mindset, to appreciate, we went back 10 years. The last 10 years have been pretty amazing. The next 10 years, things are going to get more magical. And as innovators, we need to kind of look to where the puck is going to be and integrate and converge these technologies to have true healthcare solutions.
So we were talking off camera about how, as physicians are trying to look at all of these different digital health companies and products that are coming out, how do you make sense of all of that? Where do I start when I'm trying to treat my patients, even when a consumer is coming at it? Where do I start? There's so many different things out there.
Yeah, it's a bit overwhelming. If you're coming to me as a patient, I don't want all your data. I don't want to have to look at 5 apps and look at your Fitbit data and your genomics. I want the actionable information needs to be synthesized. And then if you have a problem, whether it's diabetes, you want to quit smoking, you need to meditate more, I want to be able to hopefully prescribe you a digital health solution. It might be an app, a device, a platform. So given that there's so much out there, most clinicians, whether you're a nurse, a physical therapist, a doc, don't really have a clue what's already here and what's coming. So I've recently founded a new website, digital.health. That's the domain, digital.health. It's a bit of a digital health formulary where you can, if you have a patient with AFib, you can find there's available AliveCore. If you have a patient with prediabetes, maybe Omada Health. How do you put these things available and prescribe them to patients, eventually have them paid for by payers, and hopefully then integrate that data in so it's useful. And also provide a platform for innovators to understand what's happening with the FDA platforms for software as a medical device, or what's the data, what are the journals. So we're trying to make a home for digital health in one location.
Well, in the last few seconds, tell us about one of the interesting new devices or widgets that you're creating that you think is going to really change the space.
Sure. Well, the problem today was we practice sick care rather than health care, and we have a lot of data that's not necessarily used. We're now the ability to use AI, machine learning, to take your personal genomics, your wearable data, your connected blood pressure cuff, and hopefully make that actionable. The challenge is today, a lot of patients take a lot of pills, polypharmacy, and they have to often cut them in half. They don't take them very well, 50% non-compliant. So I've developed a new technology called intelligent medicine, where we're 3D printing personalized pills. So you could print the Daniel pill with my dose of aspirin, statin, beta blockers, Synthroid, vitamin D. And eventually the vision is that you'd sort of 3D print your personal pill in your bathroom counter each day based on your blood pressure, or if you need to be diuresed with Lasix, or need to adjust your vitamin D levels. So that start to synthesize all the available data to make it actionable, and that this information becomes shared and crowdsourced so that we can create a bit of a GPS healthcare map for patients everywhere.
Well, that is super exciting and exactly what we want to see at the Digital Health Summit at CES. Welcome. Thank you for joining me. And there you have it, Jamie Skipper from the Digital Health Summit at CES 2020.